That's cool. That's a good story.
I'd like to call to order our board of managers meeting for Thursday, December 8, 2016 at 1:08 p.m. I'd like to call Chaplain Dan Baker forward to give us our invitation.
Dear Lord, we thank you for this holiday season when we get to celebrate family and friends and share warm thoughts and feelings toward one another. Whatever our faith tradition, whatever our culture, whatever our background, it's a season just to be thankful, to seek peace, and to try to make a difference in the lives of those that we love. Let us reach out to each other and to our community and touch them with a special gift this season, the gift of love, care, compassion, health, and wholeness. We ask this in your name. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This ain't working.
Our next item on the agenda, item 3, is any citizens wishing to address the board. Okay, there be none. Item 4 will entertain a motion to approve our minutes of our November 10th, 2016 meeting.
Move approval.
Second. It's been moved by Dorothy DeBoer, second by Dr. Howard, for our approval of our minutes for November 10th, 2016. All in favor?
Aye.
Any opposes? Same sign. Okay. Next is the board chair report, item 5. The only report I have is in hopes that the entire board and staff will come and we enjoy ourselves at the end of the year celebration and Christmas cheer. It will be at the Buttons Restaurant on I-30. And so I was hoping that all will come, dress casual, don't dress up. And we're going to have just a great time. We had a great time last year. Looking forward to having a great time this year. Next item, CEO report, Mr. Early.
Thank you, Mr. Chairman. It is a good time to do a little reflecting and a good time to sort of attempt to take a break amidst all the things you got going on. But one of the things that I had the luxury of going to, there are a lot of events in the community that take place, and those folks reach out to a lot of our same patients and the folks that we're trying to administer care to. And Six Stones is a philanthropic group of individuals that care very much about their community, and they've had me out to their function 2 years in a row. And what they do is they raise money for kids and families that may not have the luxury of celebrating to the level that some of us may celebrate. And there are over 4,000 families in northeastern Tarrant County that would miss out if not for some of these events. And there are a lot of events, and I don't mean to single them out. I just want you to know that that group is no different than a lot of other groups. And what they did was they have a bus pull, and the cities and the school districts line up these buses, and they get people to pull the bus 100 yards, and whoever pulls the bus across the finish line first wins. Well, they don't actually win because each bus has to have a certain amount of money that they've collected, and then they get if they get more than they've collected, they get a couple of seconds taken off their time. And this year was no different in raising money for those families, which is great and wonderful. But you had a colleague that participated in that, and I just think that it should be known that that colleague of y'all's pulled that bus fairly well, and if y'all want to consider to what degree he pulls his weight around here, I think that should be a reflection.
Everybody's looking down there.
Let me tell you, it was pretty cold that morning, and Mr. Roger Fisher donned a T-shirt and ran out there and strapped himself to a bus and pulled it.
And left the day, fortunately, not on a gurney to JPS's room. So,
I was a little bit concerned as to why they asked me to participate, and I told them at the beginning there was no discounts at JPS for hernias or anything else that anybody would get. But I think it is, everybody has them in your community. I can name 3 or 4 in Dorothy's backyard. I can name 3 or 4 in Warren's backyard of groups that may be church-related, may be civic-related, whatever. It is a wonderful time to take a breath and take some time and say thanks to those organizations that do so much in our community. So if you all know of those organizations, I think it's time to give them a little bit of thanks for all their hard work, whether it's at Thanksgiving and providing people a meal, or whether it's a touch or a hug at Christmas time, to thank them at the holiday season to be a part of the community. So it was a nice and wonderful event. The other event that we went to, I had the luxury of sitting next to Dorothy, and Ralph also attended the event. You all are aware of the fact that JPS this year was named one of the top 100 places to work in Dallas-Fort Worth by the Dallas Morning News. That is not easy to get that. We've attempted to get that in previous years, and we didn't hit the mark. And this year, they reviewed us with a great deal of scrutiny, along with a variety of other organizations, and we were lucky enough to be one of the top 100. In fact, I believe on that top 100, we were 36th on the rank of top 100 places to work in Dallas-Fort Worth, and I'm hugely impressed and very, very pleased with that. So we went to that function. It was a very nice function. We were all excited. Roger Staubach was the guest speaker, and he did a wonderful job with a wonderful message. We all thought it was great, and then we're all waiting in line to get our cars, and Reverend Emerson walks up to Roger Staubach, and you'd think that they were distant brothers. They were hugging each other and chatting and talking, and I just thought it was cool that I was in the same room with 2,000 other people with Roger Staubach. And Reverend Emerson walks up to him, and they hadn't seen each other, I guess, in a year or so, and were acting like they were going to make sure they had Christmas together. So that was an awful cool thing to see our chair rubbing elbows with Roger. And actually, no disrespect to Mr. Staubach, but you're a lot bigger and stronger than Mr. Staubach, so I think that he was worried you were going to tackle him. I think he thought he was a quarterback again. So that was a very nice function, and that was a good place to be. We've continued with our community forums. Want to thank the county commissioners in their efforts to create county and community forums so people can voice their opinions or at least get facts and figures about where JPS is looking for its future needs. And thus far, those have been wonderful meetings. We've had one in Arlington. We had one last night in Lake Worth area. That went very well. So we've had some nice functions. They've gone really well. We've got one more. We've had one in Commissioner Brooks's precinct.
One more in Mr. Fickes's.
Right, and Commissioner Fickus, right. Yes. So we've got that one left to go, and I want to thank the commissioners. And Kathy, if you'll relate back to Commissioner Brooks, we appreciate his efforts, his time, and encouragement in that regard. So those have gone quite well for us. And then the other thing that we're going to do to stay with that theme that I mentioned earlier about caring for not only our patients but those who may not have situations as good as we would like to have them. All of us on the executive team are going over to Union Gospel, which we've done before, and we'll be serving lunch over at Union Gospel. That is we've done that, and I got to admit it's a huge amount of joy for us. And we have a great opportunity to share fellowship with some wonderful people over at Union Gospel who are seeking a few things that oftentimes are provided with friendship, a smile, and a hug. So we go over and serve a meal, but the meal oftentimes is secondary. It's the fellowship that we have that makes the difference. So we'll be at Union Gospel, and we'll be doing that on the 21st. So we've got quite a few things coming up, and things are good at JPS, and I appreciate y'all. So.
Are you cooking any of the meals?
No, they don't let me cook for that meal, but if they would, I would do it for sure. But no, I'm not, but thank you, Pastor. So that is my report. As y'all will note, and for those in the audience, and I know Mr. Keeley's aware of this, but some of our other audience members, this meeting today is usually an agenda that is slightly less or lighter than what we have during the year, because we try to begin to end things throughout the year and bring them down from the calendar year standpoint. But also, we have the other activity tonight, so we like to, from a staff standpoint, not present so much on this agenda. For those listening in on the live streaming or those in our audience, we wanted to let you know that this agenda is usually a little bit lighter than some of our other agendas. Thank you, Mr. Chairman.
Thank you, Mr. Early. Great. Our next item is report, item 7, report from the Med Exec Committee. Dr. Siegler.
We elected Physician of the Year. We had 2 of them, Dr. Lonergan from one of the clinics and Dr. Nia Karras from the Department of Orthopedics. They've both done excellent work. The other thing I need to do is that on December 17th, we have our medical staff having their party, and we want to welcome everybody to come, and I have invitations that I'm going to hand out to everybody.
That's it?
Yes.
Thank you. Item 8, Dr. Johnson, report from McLean.
Yes, sir. Thank you, Mr. Chair. Just want to give you a brief report on some high-level things going on in McLean. First, on staffing, recruiting, and retention. This information is fiscal year to date, so this is starting October, which really is when we had the majority of the group moved in at that point. For active staff, we have 200 physicians and 97 advanced practice professionals. That includes your nurse midwives, clinical nurse specialists, PAs, and so forth. Now, we do have an additional 32 physicians and 2 advanced practice professionals who are assigned to Acclaim from UNT. They were left over, and they will be moving into Acclaim as employees within the next 18 months. They were left over, and they have that roughly 18-month period where some of them, they'll be trickling in because they were either close to retirement or vesting or some other issue that would have put them at a significant loss if they had transitioned during the date that we transitioned everyone else over. So we're looking forward to having them on board as well. New hires, we've hired 4 physicians and 2 advanced practice professionals since October 1st. We're currently recruiting 21 physicians and 18 advanced practice professionals. We've had, in terms of resignations, no physicians have resigned, and 1 advanced practice professional had a voluntary resignation. Board of Directors, I wanted to update you on that. You guys have seen the names and membership come through. I just wanted to summarize those for you because they've come through at different times. We have some of the original initial and interim board, and we have some of the ones that you guys have approved at this level. The chair of that physician board of directors is Dr. Paul Bella from cardiology. The vice chair is Dr. Tim Kramer from OBGYN. The secretary is Dr. Ricardo Castellon from family medicine. The treasurer is Dr. Richard Robinson from emergency medicine. 3 other members are Dr. Therese DeWayne from surgery, Dr. Cheryl Hurd from psychiatry, and Dr. Brian Webb from orthopedic surgery. The board of directors does have a meeting scheduled at the later part of this month, and the focus of that meeting is going to be getting some work done around some committees of the board, including quality. And you'll remember we had a quality committee that stood up the metrics for Acclaim. The work of this quality committee will be to continue along with that work and revise those and answer, continue to do work around quality and quality improvement for the group. Peer review is going to be another committee that will be formed at that point, and they will be looking at peer review questions from physicians at a physician-to-physician peer review level. utilization, and the fourth committee, which is one that's already been formed and in progress, is the Credentials Committee, and that is Managed Care Credentials. So that's so that committee, as you know, has been in place for some time, and that is chaired by Dr. Navneet Gill, one of our internal medicine doctors. Service line organizational structure. We've done a lot of work around that. It's really starting to take form now. The service lines, as we see them now, include primary care, women's and infants, behavioral health, musculoskeletal, medicine, and medicine specialty. And those are the service lines that are held within a claim. Currently, outside of a claim, we also have the surgery and surgery specialty service line. And what we put together is really a hospital or service-based service line. And those are things like pathology, radiology, the hospitalist group, and anesthesia. And those are things that really provide services at the hospital. They're innate to the hospital itself. We've also done a lot of work around physician compensation. The physician compensation plan includes components of both productivity through worked RVUs and quality. That plan is in the midst of being launched right now, and by the end of January, the physicians will actually be able to see shadow reports of their income on the plan versus current state. We also stood up the two acclaimed clinics, Klabzuba, the Women's Health Clinic, our OB clinic, and Ben Hogan, the Orthopedics Clinic. It wasn't completely flawless, the startup. There were a couple of hiccups. We have to admit the things that you guess everything that happens. That things happen, and it wasn't bad, but it wasn't perfect. The hurdles that we have overcome and are in the midst of overcoming were transition to the electronic medical record. Getting them onto Epic was not as easy as we had predicted. The doctors and advanced practice professionals, specifically the nurse midwives at Klabzuba, did a remarkable job and worked a lot of extremely long hours doing things with paper and actually translating the paper themselves into the electronic medical record. The other hurdle was lab results, and we've worked several, again, more things that were entering into the record, and we do have an interface that will be up and running with through the Quest Diagnostic Interface by January 9th. A win, or there were several wins. The wins were everyone worked hard and they've made it through and they got those clinics going well. A specific win is that nurse midwife group at the Klabzuba Clinic actually delivered 120 babies during their startup month, which was by far the most they had ever had. So they had their busiest month while we were starting up. So really, our hats off to them. It's an exceptional group of providers. Also, and lastly, the physician satisfaction survey was performed. The results of that are back, and we had a meeting scheduled tomorrow actually to be briefed on those. I haven't actually seen them yet, but should have that for you, some information on that in the upcoming months. And that concludes my report.
Are there any questions, Dr.
I do.
Johnson?
I have one. I did not hear, maybe I missed it. How about the geriatric service line? Is that part of your?
So geriatrics, that is one. Dr. Weber has to find the weak spot. So there are a few things that there are a few items that we're still looking for. Where does it best fit?
Okay.
And employee health, geriatrics, intensive care. Those are still some things that we're trying to work out. Where exactly do they fit into this? And so more to follow on that. It's a great question, though. Absolutely. And it probably, as you say, our latest discussions has been that it likely could just be its own service line.
Great. Just as I'm getting a little bit older, I might want to use it down the road. 20 years from now. Yeah. Thank you. That's it for me.
Any other questions?
Thanks, sir.
You'll be back to the board in the first of the year, right? Okay? Yeah. At that time, you'll be bringing I guess the other side, those areas that we were waiting to address in the new year, all the interim positions and that structural.
Yes, sir. And that was something I did scan right over in our recruiting. I did want to mention that for we have what we consider critical recruiting, and that critical recruiting is, and there'll be more information to follow on this, is going to be those interim chair positions in the departments of family medicine, internal medicine, OB-GYN, orthopedic surgery, and psychiatry. Also at the staff level, for the frontline providers, some of the critical recruitment areas right now are psychiatry, primary care, OB-GYN, and geriatrics. Thank you, sir.
Okay.
Busy.
Thanks.
I just want to express my personal hope that we'll develop more back in the otolaryngology department. I mean, we were a place that had otolaryngology residents, and now we don't. And I consider that something we need to fix. I'll just mention it for the record. Hospital is big with all the other residencies, and OMFS has done a great job of filling in, but we need to, I will at least accept it as my personal charge that we're going to look at ENT some more, okay?
It is one of mine as well, sir.
Thank you.
Absolutely, I promise you.
Thank you.
Thank you, Dustin. Okay, next is item 9, our committee reports. First is the Finance Committee.
We met on November 17th and reviewed the October monthly financials with Ms. Clark. That's the first month of our new current budget year, fiscal year. So far, so good. We're on track. And we also passed a number of contracts that are on our consent agenda for today. That's my report.
HR report, Dorothy DuBois.
No report.
Next is the Governance Committee report. We had 2 areas that we focused on mainly. One was, or 2 items that were to come to the board today that will be on the January agenda. One was the gun permit policy. We had much discussion at our Governance Committee meeting, and so we deferred that to our January meeting where we could really take time and review that. And the other was our policies and procedures, and that will also be on the January agenda. Okay. Next item on our agenda are some matters that require board action. Item 10, the first is Bill Whitman. You by yourself?
By myself. He is a bit under the weather, but I think I can handle it. I hope I can. Good afternoon. My purpose today is to hopefully be able to turn
Get
the
the clicker to
PowerPoint
work.
presentation, which I'm failing at miserably.
The clicker operation is not a threshold goal, it is a stretch.
Wow, it is, apparently. Just to review briefly, this board approved and formalized an annual incentive plan last year. And we established goal metrics along 5 of our operating pillars. So today, we're going to review the results of our operating year that ended September 30th of this year. And I'm pleased to say that in 4 of those 5 pillars, we either met or exceeded the goal metrics that we established and you approved at the beginning of the year. You've read the narrative, and I just give up. That's crazy. Somebody else can do that. The annual incentive plan is paid to all employees, everybody, part-time, PRN people, managers and above, frontline people. And for those that are part-time and PRN, it's based on hours of work. For those who join the organization after January 1st, in any capacity, it's based on your pro rata position throughout the year. So it's equitable. But everybody is compensated based on the performance achievement, the levels of achievement. The frontline individuals, those that are part-time and PRN frontline, can receive up to $500 per person. Those in management and above are able to receive up to 10%, which is a reflection of target outcomes, or potentially up to 20% if every one of those metrics result in a level of achievement at the stretch level. So this year, you can't see that, I can't see that, but hopefully you've seen that on the board portal, right? So let me get something I can review it with you and talk about each one of these just for a moment, if you don't mind. Quality, in developing this plan, there's so many goals that we have in this organization. There's so many metrics that we follow, but we attempted to choose those that were most meaningful to the patients that we serve. What has either the largest gap to address, or if we achieve some of those metrics, what benefits the patients the most? So in terms of quality, we chose CAUTI, catheter-associated urinary tract infections. We weren't doing so well in fiscal year 15. In fact, we experienced 36 of those infections in fiscal year 15. So we established some metrics to show improvement toward that, work toward that, and actually at the end of September, we only had 11. 11's too many. Our goal is 0. That's the journey that we're on. It's achievable. We have some units that have achieved 0. But as an organization, 11's much improved over 36 the year before. And that qualifies for a target score. Not a stretch, not a threshold, but a target. Falls with injury. We experienced 9 falls with injury. Our goal is a 0, and this year we improved to 4. Pretty significant. Population health perspective, access is very much a concern for this organization. We need to get as many patients through our clinics as possible. And this particular measure is intended to measure the access or the accessibility of our clinics. It's measured in the days to next third new appointment. We didn't do well. We did not do well. We did not achieve the threshold level of performance. Therefore, there is no suggested payout for this goal. We have a lot of work to do in this area, and we're making plans to address that for the fiscal year that we're currently in. Service. We all know what HCAPS, CG caps, ED caps are, right? HCAPS is inpatient. CG caps is measuring the satisfaction, the overall rating of the provider in the clinics. So patients that experience the relationship with our providers give our intermediary, NRC picker, some rating of the interaction they had with our physicians. And ED caps is measuring the overall rating of our emergency department, the level of service that's provided when they come. HCAPS last year, you can see we were at 72%. That's the top box score. That's either a 9 or a 10 in terms of overall rating. We established some metrics thinking that if we could just improve a little bit, not expecting a whole lot, that we're on that trajectory of continual improvement. We absolutely exceeded the stretch target. We knew we could do it. We knew we've experienced this when we make rounds and talk to our patients. We weren't getting the feedback from our patients that the scores reflected. We were doing better than that. Now we're seeing results that reflect what we see when we make rounds. 79.3, that's an equivalent of 78th percentile in the nation. And 5 years ago, we were talking about the 20th percentile and the 30th percentile, and we set goals to get us to the 50th percentile, and we just didn't meet the mark. Now we are. Exceeded our wildest expectations, but we're still looking for improvement this year. CG caps, overall rating of our physicians, 72.4 in 15, 79.6 in fiscal year 16. And ED caps, we were just shy of 60% of top box rating, and we just barely met that, 60.6, a little bit of improvement. So 2 of those, CG caps and H caps, reflect a stretch target score, and ED caps reflects a threshold score. Stewardship, we really had a good year in fiscal year 15. Really good year, 8.7% operating margin. This year, we set more realistic goals, understanding some of the challenges and opportunities we had. And we have yet to report the final, and that'll come out in the audit. But what we know today is 2.54% operating margin, which would qualify us for a target score of 2.5. Productivity, we did very well in productivity, hit the stretch target. In employee engagement, how does this relate to patients? Well, we all have the philosophy that if you have a highly engaged workforce, they're going to take better care of your patients. And that's where a lot of effort has been devoted over the last several years. We finished at the 67th percentile in 2015. This year, we achieved the 84th percentile. 91% of our workforce responded to the survey, 91%. That's equivalent, not equivalent, but it's in relation to the rest of the world, the rest of the hospitals in the nation, who come in at about 75% of their workforce contribute to that survey.
Bill, I got a question on productivity.
Sure.
You said it's a stretch goal of 4%, 5.7, but the year-end result is 5.42.
Lower's better.
Okay, that's what I need to know.
Lower's better.
All right.
So incremental improvement, a 0.01 or 0.02 means a lot when you look at percentile ranking. As you get higher in terms of overall percentages, it really reflects on the percentile ranking. And there's a difference between percentages and percentile ranking. And next year, we're going to focus on percentile ranking, not percentages of top box, because that gives us an indication of where we really are performing in relation to the other hospitals that we're compared to, right? Press Ganey does our employee engagement survey. 0.01 or a 0.02 improvement could result in a 10 percentile improvement over where you were last year. We went from the 67th percentile at 4.22 to the 84th percentile at 4.29. So I think all in all, these indicators are representative of the year that we had. They're representative of things that make a lot of difference to the patients that we serve and quite a bit of difference to the employees that elect to work for this organization. So all in all, it was a very good year. I'd be happy to entertain questions, but I would sincerely ask your consideration and approval of the payout, which is on the next page by category. As I said, all of our team members that are below the manager level will receive $500 based on the level of performance that we achieved. Mid-managers, 10%, executives, 10%, for an overall total of $5.624 million, which was accrued. The overall performance of those threshold, target, stretch indicators was 12%. Be happy to answer any questions.
Any questions of Bill?
Yes, sir.
I do have some caution about the use of the urinary catheters. I mean, they are an essential part of medicine. We do work very hard to try to get the rate down as low as possible. We discussed it at the Critical Care Committee, the Patient Safety and Governance. We did discuss it at the Quality, at the subcommittee of the board. So it's something that we look at. We look at each individual case, but it is an essential part of medicine. There are just certain patients where we really have to use it, and we try to get them out as quickly as possible. But so to say we can get our rate down to zero, I think is going to be virtually impossible. But it is something we do have to pay strict attention to.
We understand the challenge. We understand that there's great opportunity for the patients that we care for, but that we're on a journey to zero in all of our hospital-acquired conditions, and that's a significant, steep hill to climb. You're right.
I want, Mr. Chair, if I could, I want to call out a few folks. When we started working on this years ago, Trent Petty and Dorothy DuBose and many of the rest of y'all played key components of this. And when you look back through this, you all will see specific aspects of this. If you'll recall from our minutes and our discussions, Trent and you, Mr. Chair, were very big that this applied to all employees. It wasn't a segmented kind of situation. It was everybody. If you look at the aspects of trying to put something of this in place, every one of you at one point in the last 3 or 4 years of discussion had an input in this that we appreciated. This is also evolutionary more than it's revolutionary. It's evolutionary in the sense that we've got to figure out how to get this right. I feel that we've got good consultants that help us with this. I think they've looked at not only what is in healthcare, but JPS is leading edge at what a lot of healthcare organizations are now adapting to. And so I'm appreciative of y'all's efforts, and I'm appreciative to our consultant that's helped put this together. Now you're just seeing the first year of this, and now I think we figure out how we move forward and how we make this work for our employees, for you as a board, and our community, to be fair.
Mr. Chairman, I would move to accept the annual incentive payout.
Has been moved by Dr. Lowry,
Second.
second by Dr. Weber. Before we vote, I just have one question, Bill.
Yes, sir.
Really impressive, but those areas that maybe were not just where you want an example, ED, are y'all able to identify where the shortfalls are in those particular areas, or do you just look at it overall? And
No,
shoot?
no, we have a pretty good understanding of where all the opportunities are by unit.
Okay,
And there is a significant correlation in ED boarding and overall ED satisfaction. To the extent that we can't get our patients out of the ED and off the walls that are being admitted, and they're literally on the walls, we continue to struggle. It's a capacity concern. We've certainly addressed it from a patient care perspective, from a relationship perspective, but there's only so much one can do if there's overcrowding and you're waiting down in an overcrowded situation for hours.
okay.
Does that answer your question?
Yes, yes, it does. But I have another one then.
All right.
Okay.
Follow up.
And it doesn't really address the incentive plan, but let's just say yesterday we cut the ribbon on a new facility. Would that have any helpful impact on that situation?
Oh, it certainly should. When you have 51 or 52 exam rooms, you have an ED that was built to accommodate 86,000 visits a year, and we're seeing 120. To the extent that we have capacity and adequate, trained, competent staff to accompany that capacity, it'll be a world of difference.
I will also say, Mr. Chairman, that Dr. Weber and Mr. Petty, when we sat in the ECR 8 years ago, knew that our biggest problem was in the ED. It was wait times, it was left without being seen rates. We've conquered so many of those critical key areas, but to Bill's point, if we push that balloon this way, it's going to ebb and flow in other directions. And one of the challenges that we have is our ED has become much more efficient, even though what we saw in 2007 was 175 people a day, and now we're at 380 people a day. Even though we fixed a lot of those issues, you still have the significant problem that we are efficient and faster in the ED, but you still can't find a bed because you're at capacity from a bed standpoint. It's really hard to get a decent rating when somebody's going to be in a bed in the ED waiting to be admitted. And we're doing everything we can. We're trying to figure out bed space wherever we can figure. We think victory is huge when we can figure out where 16 more beds are. That is a huge increment of help. So I'm pleased with what's taken on, because this discussion would be significantly different if we were still talking about ED and its problems of 8 years ago.
No question.
Yeah, and I asked it because I wanted, audience, those who are streaming, looking, and plus our board and those present, just to see the seriousness really of us moving and an impact of a bond program and how it could efficiently affect our operations at JPS.
Yes, sir.
So I wanted to get that out. That's why I said.
I agree. I think it's imperative as we go forward with this bond thing that some of the naysayers have an opportunity to look at real numbers.
Yes.
Because we're doing eons better than we did, and yet there's so much further yet to go.
Yes, yes. And so anytime we can get that out, I think it's good that we can. All in favor of the action of the incentive pay plans, signify by aye. Aye. Any opposes? Steve really wants it to pass.
Thank you all very much. On behalf of 6,500 employees, thank you all very much. Appreciate that.
Okay, our next item is appointment, reappointment of Scott Rule to the tax increment financing, tax and reinvestment zones.
So
Move
moved.
for approval.
Moved by Charlie Pound, second by Dr. Weber. All in favor? Any opposed? All right. And I'm sorry, that was the city of Colleyville and the city of Arlington. Okay, so you include that in the motion. Okay, I'm sorry.
Okay.
Item 9 is approval of the consent agenda. Entertain a motion for the consent agenda.
So moved.
Second.
It's been moved by Mr. Steve Montgomery, second by Dr. DeBose, Dorothy
Doctor,
DeBose.
thank you for that.
It depends on what you're a doctor of, but
All in favor? Any opposes? Same sign. Okay. Next is, we will now. Yeah, okay, general counsel, I'm sorry. Neil said he'll wait till tonight, okay. All right. We'll reconvene now into executive session pursuant to chapter 551 of Texas Government Code for the following. We'll now convene back into open session. We have one final item, and that's approval of privileges.
Move for approval.
Second.
It's been moved by Warren Norad and second by Dorothy DeVos.
No.
All in favor? Aye. Any opposed? Same sign? Okay. There'll be no further business. We stand adjourned